All right, welcome everyone. We'll go ahead and get started. I'm Amelia Josephson, Senior Manager of Innovation at Financial Health Network, and I lead our Financial Solutions Lab Exchange program. We believe that when fintechs and nonprofits work together, they can offer a powerful combination of well-designed tech solutions and supportive relationships with trusted partners to improve financial health. This year, we've been featuring each of our three 2022 Exchange grantee partnerships in a series of webinars. Each grantee partnership is focused on improving public and private benefits access and navigation. We've hosted webinars with grantees in the rental assistance space and in the public benefits access through financial coaching space. And I'm pleased to welcome you to today's webinar focused on the childcare sector. America is in the middle of a childcare crisis, with many families struggling to access affordable, quality care, while providers also struggle to earn a living wage. Meanwhile, billions of dollars in government childcare funding go unclaimed every year. Our presenters today are working to solve this urgent crisis. As we hear the presentation from Nebraska Early Childhood Collaborative and PIE for Providers, please share your questions and reactions in the Q&A feature or in the chat, and I'll be sure to put your questions to our speakers during the Q&A portion of our agenda. Our speakers will be Brandy Lengel, Vice President of Quality Childcare Partnerships at Nebraska Early Childhood Collaborative, and Gita Surti, Director of Marketing and Business Development at PIE for Providers. Over to you, Brandy and Gita.
Thank you, Amelia. As Amelia said, I'm Brandy Lengel. I'm the VP of Quality Childcare Partnerships at the Nebraska Early Childhood Collaborative, which we affectionately refer to as NECC. So you'll hear me refer to that as the presentation goes on. At the Nebraska Early Childhood Collaborative, we give parents and childcare providers the support and resources they need and want to give children the education they deserve. In a bold and creative way, NECC leads the field in its approach to community support, business resources, and educator training. Ultimately, we believe that if childcare providers and parents have the resources and support they need, children will do their best. Our vision is more children prepared for school, prepared for life. In 2020, NECC launched the Child Care Network to respond to a growing need to support childcare educators. So we had a specific focus and emphasis on family child care, and those are the providers that are doing childcare in their home. Prior to joining the network, many family childcare educators were isolated with little to no prior business training and had limited access to support. Next slide. Family childcare providers face several personal and business challenges which affect their financial health. These challenges are often magnified by the fact that many of them do not separate their business and their personal finances. This can make it difficult for them to track an accurate profit or loss statement from their business. The family childcare business model has not significantly changed in the last several decades, if ever. This business model does not work for most modern families that rely on two incomes to make ends meet. So the idea that a stay-at-home mom might watch a few extra children to bring in supplemental pay for her family just isn't doable in today's society. Most family childcare providers started this work because they love children, not because they were savvy business owners. Many don't see themselves as business owners, and they have limited access to business and technology experience, training, education, and that is a real problem for the profession. In addition to these problems, providers also have limited access to revenue streams. So typical family childcare revenue streams include private pay family fees and a couple of government subsidized programs, including the Child Care Food Program and the Child Care Subsidy Program. Almost all providers that we work with have incurred some kind of business bad debt as well. A survey we completed in 2021 found that almost all providers had incurred bad debt in the prior year, and almost 20% had incurred over $1,000 in bad debt. Bad debt can include parents leaving without notice, parents not paying their tuition, parents not paying for their child care subsidy co-payments. Not represented on this chart is also a significant amount of money providers lose out on from the child care subsidy program. This could be because of complex billing rules, errors on their billing forms, limited capacity, specifically around time. Many providers are fearful of making mistakes on their childcare subsidy billing, and so they bill for less hours than what they are actually allowed. And they're unable to claim tuition if a child doesn't attend because of a variety of reasons. Next slide. Because of these reasons, childcare providers are unable to claim thousands of dollars each year from the childcare subsidy system. With a $35,000 average annual income, that's over 8% lost annually. Next slide. The $5.9 billion Child Care Assistance Program, also known as the Child Care and Development Block Grant, which is also Child Care Subsidy, which funds the federal Child Care Subsidy Program, is our country's largest and primary financial support program for working families. However, in Nebraska specifically, only 8.4% of those eligible families that are currently eligible utilize the funding. This is not a budget problem, it's not a licensing problem, and it's not a problem specific to Nebraska. There are currently no wait lists for childcare subsidy in 37 states, and 41 states license exempt providers can also access funding. And those are providers that are operating legally in their state, but without a childcare license. Next slide. Access to the Child Care Payment Assistance Program is especially challenging for home-based child care providers. Only 12 to 21% of those providers participate in the Child Care Subsidy Program. A large portion of the remaining, almost 80% of paid home-based providers quite likely serve a lot of families that would qualify for child care subsidy, but they are not. They're not participating and they're missing out on a crucial financial support. Through our partnership with Pie for Providers, we've been able to take some of the burden of participating in the Child Care Subsidy Program off of child care programs. This has allowed them to serve more children, access available funding, increase their income, and decrease their stress. I'm going to turn it over to Gita to share more about Pie for Providers.
Thank you so much, Brandy. Thank you for detailing the challenges that providers face so comprehensively. My name is Gita. I'm the Director of Marketing and Business Development at Pie for Providers. And we are a company that builds technology that helps providers access the billions of dollars of government funding that is available to support their endeavors. We are extremely passionate about childcare, supporting childcare providers, because what they have been dealing with, not only since the pandemic, but for years prior, is often just overlooked. We can all agree that childcare is a backbone of our society. With the state of parental leave as it exists today, or the lack thereof in our country, in some cases, it actually is what enables growing families to keep a roof over their heads, to allows teachers to continue to educate, it allows doctors to care for patients, it allows police forces to protect communities, and so on and so forth. So we feel strongly about childcare. Next slide, please. So the average salary for a childcare provider currently is around $35,000 a year. And that equates to roughly $3,000 a month, and that's without taxes taken out. So it's pretty sad state. And if you look at the cost of living, next slide, please. The average cost of living in the United States is, for one person, $40,859 annually, and that's about $3,400 a month. And for an entire household, or households that include people ranging from 1 to about 5 people, it's almost $6,000 a month, or $66,928 annually. So we can right off the bat see how childcare providers are severely, at least not making a living wage in most cases. Next slide, please. So the problem, as Brandy introduced with the CCDBG specifically, which is the main source of childcare assistance in our country, is that it requires providers to keep impeccable records. Children have varying schedules that they are eligible to receive funding for. They have various time allotments, day allotments, hour allotments, etc. And providers are responsible for keeping track of this. So if they choose to participate in the program, they're required to keep perfect records. And each and every state actually has a different set of rules for reporting attendance. So it may vary from, keeping a paper calendar. It may vary from that to like submitting something on a portal, submitting something over the phone. There's different rates of pay for the different types of care that are delivered. So whether it's school-aged, toddler, preschool, infant care, all have different rates. And let's face it, providers already have a very limited capacity, especially if they are running their own business from their home. They have to worry about paying bills. They are responsible for maintaining proper facilities, stocking their classroom, creating lesson plans, managing food preparation, dealing and communicating with parents on perhaps a daily basis. So routine administrative things like even routine administrative aspects of billing may be difficult for them to set aside time for. So to consider now another level of administrative tasks dedicated to government funding is to add a layer that they just don't have the bandwidth for. Next slide, please. So despite all of the challenges with the child care subsidy program, obviously there's a great opportunity there for families. It gives them access to quality care. It's more affordable. In some cases, because of the child care subsidy, families can choose a facility that offers a higher level of education than they would normally, which is actually one of the reasons the program exists. It helps families, facilitates their personal financial health. So it helps women and mothers focus on their careers, on their education. And it just equals the playing field when it comes to who can access quality childcare. Next slide, please. Now, the opportunity for childcare providers with the subsidy, it offers a reliable paying source. So when the government is paying the checks for childcare, there's no concern of missed payments, delayed payments. Well, hopefully not, but as long as everything is, submitted adequately, it's a reliable payment that they will receive. It offers an opportunity for bridging the gap between having access to child quality care. Next slide, please. So overall, when providers are compensated adequately, it gives them the opportunity to do the more meaningful work that they went into this profession for in the first place. That trickles down into benefits for the entire community. For families, we already went over how it helps families build their personal wealth, have better jobs, lower their stress level. For children, they're getting more stability. Studies have shown that children who have more consistent providers from an early age, they thrive later on in life. We're helping local economies thrive. Small childcare businesses are opening jobs for the work, creating jobs in the workforce. And then with higher pay and more meaningful work, you will see less providers leaving the profession. And this can lead to more spots available for the low-income families. Next slide, please. So here at Pride for Providers, we help childcare providers manage the subsidy program and all at the same time maximize the funding that they do receive from the program. So with our technology, providers are able to get a bigger slice of that childcare subsidy pie, the 5.9 billion that we were talking about. They can spend less time doing billing and spend more time on what really matters, which is quality early childhood programming for children. Next slide, please. So you can think of the technology as a TurboTax for childcare. We help providers claim more money by finding missed opportunities for revenue. We help give them accurate real-time revenue projections, and this helps with subsidy, with allocation of funding or allocation of income. It reflects the complex rules of the subsidy and gives providers control over their businesses. And third, we save time by eliminating the monthly billing process and putting all the information needed in the state's format, in the format that the state requires from providers. Next slide, please. So this is what providers see when they log into their Pi for Providers application. And the way it works is that we take in attendance data, and the app can tell a provider exactly how much money she's owed for X days of care, X hours of care, depending on her license type, the county, the child's age, dozens of other variables. And like I mentioned before, each and every state has a different setup. So we're building these complex rules in a scalable way so we can support providers ultimately nationwide with our open source rules engine. Next slide, please. So as I mentioned before, we offer revenue projections based on attendance that has been entered into the system, and this helps providers manage their businesses properly. Next slide, please. There's also attendance tracking. So childcare providers no longer have to take a calculator and add up minutes of care delivered from day to day to in order to get paid for the care they're delivering. The app takes care of this and assigns a full day tag or a partial day tag or however many hours of care were delivered, and it totals it at the end of the month. Next slide, please. So some of the things that we've heard from providers after using our product is that they love to just have everything in one place. There's less paperwork. It's helping them with their time management, that now they're able to get other things done. A lot of programs experienced significant losses during COVID, and they feel that this has benefited them tremendously. Next slide, please. So our partnership with the Nebraska Early Childhood Collaborative really allowed us to take our services to the next level. We piloted a program in which childcare providers and centers in Nebraska were able to receive a full service end-to-end subsidy billing service. So straight from attendance entry, starting from attendance entry all the way down to online claim submission to the Nebraska government entity that handles the reimbursement checks. So we actually removed the childcare subsidy billing task completely. And we actually just wanted to see whether providers would be receptive to this or not. And it actually, we had incredible results with this program. Next slide, please. So one of our pilot participants was Bellevue Public School System, and they have 15 before and after sites, before and after care sites, and around 85 children at the time of the pilot were receiving subsidy funding. Danielle Moss is the director for the program, and she actually supports each individual site leader to help them manage the subsidy. So because each site has different nuances, and also each site leader has a different level of knowledge of the child care subsidy. Not everyone takes a course on how to manage and bill for the child care subsidy. I don't even know if such a thing exists. So some of her challenges were with the varying levels of knowledge, there was inconsistency in billing. So what our program allowed them to do was increase their revenue by 34% every month. They saved 6 hours per childcare site per month, which is a total of about 75 hours saved. And the site leaders had peace of mind knowing that there's a one-stop shop for their subsidy billing and everything was being billed consistently. Next slide, please. Another participant in our pilot was Gina Kozak, who runs Darlin Daycare. And she's an excellent provider, years of experience, years and years, and however, still so much paperwork. And she felt that if it doesn't get done, sometimes the payments would be delayed, right? Like if you don't submit the payments on time, your payments are naturally delayed. It causes like a domino effect in operating a business. So the outcome of utilizing the full service billing service is that she made $150 additional revenue per month for each child receiving funding. She saved over 5 hours every month. There were 0 errors in her subsidy billing, and there was just a lot more control and less stress about her financial outlook. Next slide, please. So overall, the partnership has impacted providers in 2 different ways. So one aspect is the increase in revenue because of billing properly. So we isolated, the impact specific to just the software alone, and then specific to the tech-enabled shared service. So specific to the software, 5% growth in subsidy revenue, about $318 per year per child, including the program, 27% growth and $804 per year per child. As far as the aspect of saving time for the providers, in regards to the software, it resulted in 64 hours per year per provider. In regards to the tech-enabled service, 72 hours per year per provider. So tremendous impact. Some of the things we heard is that they feel from childcare providers directly, is that they feel that they're getting every dollar they're owed. They feel less stressed, they're saving time. They're more open to accepting the childcare subsidy program. They're not required to at this point in time. So some of the key aspects next slide. The key aspects that we took away from participating in this program and the partnership are we actually gathered much stronger and accurate attendance data that can highlight trends that we can use then to support advocacy in the early childhood education field. We gained insights on the provider experience, things that we make a lot of assumptions about what providers experience, and by going through the actual process on their behalf, gave us a firsthand view. And now we are able to conceive of and refine products and services that are specific to provider financial health. And providers, we noticed that they do welcome technology innovations. However, if the tech innovations are creating another layer of work, it's not going to work. So tech innovations are great, but as long as they can increase efficiency and reduce the lift of the providers are doing. And we can actually make a difference. it may be baby steps, but every additional dollar earned makes a difference. So working together has been fantastic, and very, very fruitful.
Just building off a couple of your takeaways, Geeta, I would also just add that, initially we worried that the providers wouldn't be able to, navigate the technology or they wouldn't embrace it. But what we really found is that they were very receptive. They learned it very quickly. Even though they doubted themselves at times, they really went through this process, I would say fairly easy. So I think that's really one of the things that we learned. And then the other thing I would just add is that over the last several years, Nebraska's child care subsidy program has went through a lot of changes. At some times it was challenging for us to even keep up with all of the changes. So knowing that we were supporting providers and giving them as much information and support as we could, that was something I thought was really beneficial from our partnership.
Absolutely agree.
Yeah. Next slide. So I would just, I have a quote on here and I would just repeat it. Like, NECC is so happy to connect Nebraska's early childhood programs to PI for providers. This program has helped early childhood programs maximize their subsidy claims and increase and reduce the potential for errors and increase their income.
And likewise, having the opportunity to approach providers internally with the with the acceptance of the Nebraska Early Childhood Collaborative, we automatically gained providers' trust because they really rely on the collaborative to support them. So this gave us an opportunity to connect with providers much more easily and join together and make a direct and lasting impact. So we're really grateful for that opportunity. Next slide, please. And lastly, we'd just like to offer an opportunity to hear directly from Danielle Moss, who I mentioned is the director of the entire Bellevue Public Schools before and after care program. She has some impactful thoughts that she shared with us, and we'd like to share with you as well.
I think that this is the best thing for our program, and we're really seeing a difference. But it gives you time back, but then it also allows you, because it's being billed correctly, more income, and therefore you can reach more families. You can say, you know what, we accept subsidy, and here's we might be their only consistency. We might be their only meals for the day. We don't know that. But we have found that is what we do see a lot of times. So it's important for us to be able to provide it for them. Because subsidy is stressful, and it's stressful for billing. I've worked in this business for a long time, and subsidy has always been one of those scary unknowns. I have 15 sites, 15 locations, 15 site leaders, and not all of them are billing the same. There was just a lot of billing errors. We are recouping about $10,000 more a month, because it's being billed correctly. We operate based on a revenue. We want to put back into our program and add value. And the only way we can do that and add value to our staff as well, and that means giving them higher wages, and that means buying the newer supplies, iPads, technologies, giving them a higher budget for their curriculum and materials, our summer curriculum and programming. But that all comes from somewhere, because I can look at this PI for PI's software, and I can see all these at risks, and I can understand what that means. That means that they're not making what we could be making. They're not attending what they should be attending or what they're signed up for. We're not receiving what we could possibly receive, and that's a bummer. And that's a lot of money because you see the potential income and
Yeah.
then the actual income. And, you know, it's just wild to me. We still have to staff the same, you know, and all that. We still have to provide the same materials regardless.
Yes.
We can financially see the difference. So we know that it's paying off. It's just the complete billing from start to finish. And you're giving ultimately the site leaders time back with their families, with their kids, and with the program. They're not sitting there at a table or at a computer worried about whether they're doing it right, but it takes the bulk of the responsibility out of your hands, and it's billed consistently across the board. And you're giving time back to your program. It definitely alleviates a lot of stress off myself. You know, again, we're adding value to the program, and that's what's important to us to move forward. And you guys help us add value and then, you know, impact the lives of children, so, and staff, you know, because the more money we bring in, the, again, wages can increase and so on and so forth. So I do appreciate.
Thank you so much.
Great. Thank you so much, Brandy and Gita, and thanks for the opportunity to hear directly via Zoom from one of the providers that you've worked with through this program. We had a question come in from the audience, and I think Danielle spoke to this a little bit from her experience about kind of where those extra subsidy funds tend to be allocated once they come in. Is it educator and provider salaries? Or, you know, alleviating other cost pressures. So things like facilities, food, curriculum, family engagement. It sounded like Danielle was saying that her focus has been on paying staff higher wages, but also on supplies, curriculum, materials. Is that kind of a typical split?
That's pretty much what I was thinking. It was like yes to both the questions. I think it is going to higher salaries, and specifically in a program like Danielle's, it's her staff are probably part-time staff, and they're working when they have children present. And so if children are attending more, then definitely staff would be working more. But with all the costs of everything raising, I would anticipate that they'd be using it for all costs.
That makes sense.
Yeah.
And Gita, how has the experience of working with providers in other states outside of Nebraska been? I'm sure there are folks joining us today who may be wondering how providers in their states can access the Piper Providers technology.
Great question, Amelia. Today, we have the product customized for Nebraska providers and for providers in Illinois. So there's a lot of room for growth. And we are looking to expand to, you know, ultimately to all states. As I mentioned, the product is very customized based on the each various states process for submitting billing. And yeah, first, everyone has a customized and specific process. So the rules engine needs to be customized for each and every state, but we are looking to expand to other states. So each and every person can go right on our website and go ahead and sign up. And if we are not in your state, you'll receive information as it becomes available. We will update you accordingly.
Great. Yeah, it sounds like a lot to first kind of build that engine for each state, but then keep up with the changes that Brandy was mentioning, some of the rapid changes just in Nebraska alone. So exciting to hear about those plans for expansion. Brandy, you mentioned that part of the value of the network at NECC is that providers are less isolated, they're connected to each other, to resources. Tell us about some of the educator training and other programming and supports that you offer.
Okay, so yes, we have just really a collection of different programs and services that we offer through the Child Care Network. One of those is a licensing toolkit program for providers who are not yet licensed but would like to be. That program pairs them with a one-on-one mentor, and they also receive these great licensing toolboxes that contain the materials and items that they need to become licensed. So think first aid kits and wired smoke detectors and a fire extinguisher and things like that. And it also connects them to a community of other providers who are also in the process of getting licensed so that they can use each other for a resource. We have a business training series is curriculum created by All Our Kin out of Connecticut that really walks the provider through all the aspects of running a small business. So their contracts and policies, risk management, insurance, all filing taxes. That course is a 30-hour course that providers take over the course of 10 weeks. We also have a resource hub called the Nebraska Exchange, and that really is a repository place for providers to go to get access to forms. So they might be looking for a sample policy or a sample contract. They wouldn't have to recreate that from scratch. All of those resources are fully customizable, so they can put their own logo on it and change it up if they need to do that. We also provide tax prep support, so helping providers maximize their deductions through their tax preparation. I feel like I could kind of go on and on.
Sounds very comprehensive. And are there similar networks in other states, or what does that kind of national landscape look like?
So in Nebraska, we call ourselves a child care network, but a lot of states have similar organizations operating staffed family child care networks or child care alliances. So definitely, if you are looking for a child care network in your state, you could contact me and I could get you in touch with who's doing that in your state.
Great. And we'll have both of our speakers' contact information up on a slide at the end of the presentation. Gita, I've read and heard that a lot of the childcare providers are primarily Spanish speaking, and wondering if for providers, if your technology kind of accommodates that, or what you've learned from developing or engaging with Spanish speaking providers.
Yeah, Pipe for Providers is actually available in English and in Spanish. There is a significant proportion of our population of providers that are primarily Spanish speaking. So we have bilingual staff members who can engage with Spanish speaking providers in their language. So yeah, we are fully accommodating from both the customer service perspective and the technology as well.
Great, that's great to hear. I know sometimes the technology build out happens within the customer service, offerings in other languages lag behind. So great to hear that both of those are available for folks. Looks like we had a chat come in. So in the chat, you'll find links to both our speakers' organizations' websites that you can follow up on after today's webinar. The next slides get into some of our upcoming events here at Financial Health Network. We have our Emerge Insights event coming up next month in Philadelphia, September 26th to 27th. And then we hope you'll save the date, June 5th to 7th in Chicago for our Emerge Financial Health Conference, where we'll be celebrating 20 years of the financial health movement. I'll leave the next slide up for a bit so you can jot down contact information if you'd like for myself and for our two speakers. Thank you so much, Brandy and Gita. It's been a pleasure working with you and learning from you over the course of this grant term. And thanks to all of you on Zoom for joining us today. Take care.
Thank you so much.
Thank you.